So this is one of the biggest challenges nowadays, because we may have a number of different phenotypes that are linked to male infertility, such as azoospermia, astenospermia, or oligospermia. But at the same time, in very, very few cases, we do know the underlying pathology. And in most of the cases, we know that there are more than one causative factor. So we may have the same phenotype, such as astenospermia, with lots of potential causative factors underlying. So nowadays, what we do is, once male infertility is diagnosed, we aim for a very detailed medical history taken by a specialist such as an andrologist, in order for secondary factors to be acknowledged, such as the use of a kind of medication or anabolic abuse or drug abuse, history of drug abuse, or history of chemotherapy. All of these secondary factors may have a severe impact on male fertility. So once these secondary factors are acknowledged, then we may aim to improving male infertility, if this is possible, by the cessation of these medication, let's say. But if we have no secondary factors present, then the male infertility is termed idiopathic. And unfortunately, in these idiopathic male infertility cases, there are only very few cases that have been linked to efficient therapeutic options, such in case of hormonological disruption or in cases of an infection. In all the rest of the cases, idiopathic male infertility is not linked to an efficient treatment option, and so these males cannot hope for a recovery of their fertility. So for these men, IVF, or in terms of conventional IVF or IUI or ICSI, is the only option. And the good news is that for these men, the success rate normally provided by the assisted reproduction techniques are very high and very promising for them. So they should keep on hoping that they will eventually become fathers, despite the fact that we do not currently have enough hands good and efficient and targeted therapeutic options for them to hope for recovery of their fertility.